This week in Healthy Living, naturopathic Dr. Jacqui Fleury joins me, and we are learning about why midlife women are struggling with bloating and food sensitivities, a wide variety topic. Good morning, Jacqui.
Good morning, Chantal.
So what are you seeing right now? What's trending when it comes to this topic?
The topic of SIBO, which is small intestinal bacterial overgrowth, so that's a mouthful, but basically what I'm noticing online is there are influencers talking about having this overgrowth in the bowel, and this is something that I've worked with for many, many years. And so conventionally what's often offered is a course of antibiotics or to try and address this overgrowth of this bacteria in the intestinal tract. And well, you might be wondering, how do I know if I have this scenario? Often it will present as gas or bloating, heartburn, constipation, diarrhea. Like there's a whole collection of symptoms that can be associated with this overgrowth. But it also is an indication of what I like to call a weedy garden. So you and I have talked about this whole concept a few times, but just understanding that if you think about your gut as a garden, you have weeds and flowers and then the compost, which is the food that you eat on a regular basis. So we really want to look at the gut as the terrain rather than as a condition that we need to fix.
Okay, so when we look at fixing and weeding the garden, what does that look like?
So we want to think about what are we addressing in terms of the terrain. So if we think about the weeds, it's not so important that we identify what is that particular bacteria. In some cases that can be very helpful. And if you remember a couple of weeks ago I was here talking about parasites. So that was an example of a weed in the garden. So now we're talking about bacterial overgrowth. But essentially what we're looking to do is create an environment that is not very friendly to these microbes to be able to exist. So we want to create an environment that has more flowers. So we would do things like we would use a good antimicrobial, perhaps like the sludge. We'd add some fertilizers, so maybe a good probiotic. And then we could look at the diet for that, for the compost that we're putting into the gut on a daily basis.
Okay, so a few supplements mentioned there. And then how does this support the gut going forward? And maybe, you know, we wouldn't need to have those antibiotics or do it the natural way.
Right. So essentially we think about, especially in the menopause gut, because we lose the biodiversity, which is essentially we don't have as many flowers in the garden anymore. So even one round of antibiotics will throw that balance off even further. So we want to think about what's the long-term approach to keep the gut, to keep the garden nice and flowery and not so weedy. So thinking about the weeding, the fertilizing, and then keeping the food supportive and in a way to feed all the good bugs. So things like the ferments and a good quality soluble fiber, those are all things that we want to work into our diet on a daily basis.
Is there anything else you'd like to add, Jacqui, about bloating and food sensitivities, this trending topic right now?
I would say that if you had symptoms coming into menopause, often menopause is an amplification of those underlying imbalances. So there are blood tests that you can do that tell you whether or not you do have a food sensitivity. There are blood tests that tell us how your body is handling inflammation. So I think just customizing your nutrition and your protocol specific to you helps take the guesswork out of figuring out what's going on in your own body.
Okay, learning a lot this morning. Thank you so much, Jacqui.
Thank you.